A 32-year-old male presented with headaches and new onset epilepsy. I am showing you axial T1 weighted, T2 weighted, and post-contrast axial or sagittal brain MRI scans. Describe the findings.
Okay, assessing the provided imaging. The MR images demonstrate a large, well-defined lesion located in the right cerebellar hemisphere. This lesion is predominantly cystic in nature, appearing low signal on T1 and high signal on T2 weighted images. Following intravenous gadolinium administration, there is faint enhancement of the thin cyst wall and intense, uniform enhancement of a solid peripheral nodule located along the posterior aspect of the cyst. The sagittal post-contrast scan confirms that the mass exerts local pressure effect on the fourth ventricle. There is mild hydrocephalus, visible as prominence of the third and lateral ventricles, likely due to obstructive CSF flow.
I am showing you a magnified post-contrast axial MRI. What is the diagnosis and what is the differential for a cystic posterior fossa mass with an enhancing mural nodule?
Okay. The diagnosis is a cerebellar hemangioblastoma. The differential diagnosis includes a juvenile pilocytic astrocytoma, a solitary cerebellar metastasis, and an atypical medulloblastoma. A juvenile pilocytic astrocytoma is the most common infratentorial tumor in pediatric patients, showing an identical cystic component and an enhancing mural nodule. Cerebellar metastases should always be considered in older patients, whereas medulloblastomas typically present in children as midline fourth ventricle lesions.
What is the pathology of hemangioblastomas? Explain their typical demographics and association with systemic syndromes.
Haemangioblastomas are benign, WHO grade 1 vascular tumors affecting the central nervous system. They represent the most common primary infratentorial brain tumor in adults, typically presenting in the 3rd to 6th decades. Crucially, up to 20% of hemangioblastomas occur in the context of von Hippel-Lindau disease. In these patients, the tumors present much earlier in childhood and are frequently multiple, involving both the brain and spinal cord.
Discuss the systemic manifestations of von Hippel-Lindau disease across other organ systems.
Von Hippel-Lindau disease is an autosomal dominant inherited multisystem disorder caused by mutations in the VHL tumor suppressor gene on chromosome 3. It is characterized by a predisposition to develop a wide spectrum of tumors, including CNS and retinal hemangioblastomas. Abdominal findings include bilateral renal cell carcinomas, multiple renal cysts, and pancreatic neuroendocrine tumors, or cystadenocarcinomas. Patients can also develop pheochromocytomas, liver hemangiomas, and epididymal cystadenomas.
What are the management and treatment options for this patient, and how would you manage them as a radiologist?
In that case, the primary treatment for a symptomatic cerebellar hemangioblastoma is surgical resection of the enhancing mural nodule, which is curative. It is not necessary to resect the entire cyst wall, as the cyst fluid is produced by the mural nodule and will regress after nodule removal. As a radiologist, I would recommend a complete screening of the spinal cord with contrast MRI to rule out synchronous spinal cord hemangioblastomas. I would also recommend screening the abdomen with CT or ultrasound for renal cell carcinoma or pheochromocytoma, and refer the patient for genetic counseling.